Hello and welcome. This is a PaceMed clinical tutorial. We'll be doing the cardiovascular examination today. Hello.
Hello.
What's your name?
Murmurs.
May I examine you today?
Yes.
Thank you.
Begin the exam at the foot of the bed while the patient is propped up. Look at the bedside whether there's any supplemental oxygen. Assess whether the patient is rest distressed or has cyanosis. Assess whether there's hyperactive pericordium. Start by inspecting the hands. Check for pallor. Assess the capillary refill. Assess for temperature gradient as signs of perfusion. Inspect for stigmata of infective endocarditis such as Dennery lesions and Auscultation nodes. Examine the capillary beds for splinter hemorrhages in infective endocarditis and quincus pulsation in aortic regurgitation. Assess for finger clubbing, which occurs in infective endocarditis, atrial myxoma, and congenital heart disease. Examine the Lovey bone angle at the level of the eye and examine for the Shamroth's window. Assess the radial pulse for rate, rhythm, and volume. Assess for any radial delay or any radiofemoral delay that can occur with coarctation of the aorta. Assess for the character of the brachial pulse and volume. Assess for any collapsing pulse which is seen in aortic regurgitation. Measure the blood pressure. Assess the character and volume of the carotid pulse. Do each carotid artery at a time. Assess the jugular venous pulsation. Do the hepatojugular reflex and see the rise in JVP. A more than 4 centimeter rise is considered positive. Assess the eyes for any corneal arcus and xanthelasma. Check for pallor and jaundice. Inspect the oral mucosa for any dental caries, any central cyanosis, or any high arched palate. On the inspection of the pericordium, continue the inspection at the side of the patient by using your pen touch. Feel for the apex bit, which is the point of maximal impulse, the lowermost and outermost point of maximal impulse. Palpate with the finger, check for the character of the apex bit, if it's heaving or tapping. Assess for the level of the apex bit by counting from the second intercostal space.
Check for any heaves or trills at the apex and the left lower sternal border.
Check for palpable P2. On auscultation, start at the apex, listen for S1 and S2. Then listen for additional heart sounds of S3 and S4. Then listen for any murmurs at the apex. In the lower left sternal border. And the abs point. In the second intercostal space. Listen at the second interspace on the right sternal border. Complete the exam by assessing for pedal edema, special maneuvers in the CVS examination. You can listen to the murmur of the mitral stenosis by using the bell of the stethoscope. Auscultate with the bell of the stethoscope and tell the patient to turn to the side to bring the heart closer to the chest wall to hear the murmur better. In tricuspid regurgitation, the murmur at the lower left sternal border gets louder with the patient leaning forward.
Hold your breath.
And on inspiration, this is known as the Cavallo's sign.
OSCE is a medical education platform that is student-focused. We have several programs that are dedicated to medical students from year 1 to year 6. We have online question banks, that is OSCE question banks, history-taking question banks, MCQs. We also have programs for KMPDC students who are foreign trained, and we also have programs for medical officers undertaking the postgraduate exams. Our core values are reflected in our motto, which is Docendo Decimus, which is by teaching, we learn. If you want to learn more about us, follow us on our channels in YouTube, Twitter, Instagram, and look at our dedicated website for more.